Peter, let's begin to talk about the magnitude of your relief operations and what your organization, Caritas, is doing when the needs are so enormous.
Good afternoon, Asieh, to you and your viewers. Since the beginning of the war and the escalation since the 23rd of September, Caritas Lebanon in all its departments, from the social department, health department, youth, emergencies, livelihoods, throughout its different departments have been in the field 24/7, trying to support our community in every way possible. So till today, from 25 days till now, Caritas Lebanon has provided more than 100,000 internally displaced people with more than 900,000 services. And with that, I include in those services distribution daily of more than 40,000 hot meals and sandwiches, distribution of food kits, hygiene kits, dignity kits for women, clothing, mattresses, blankets, different types of service for the community. Even our health department is trying to provide health services, so more than 12,000 health services so far, from diagnostic tests to medical consultations and distribution of medicine in shelters, and to the families who have been living with relatives across the country that have fled the area where it has been mostly affected.
So Peter, what do you see as the biggest need right now for this displaced population? More than 1.2 people have been forced to flee their homes. What do they need the most right now?
Yes, as you said, more than 1 million, that's a quarter of the Lebanese population left their homes, and they don't even know if there are still homes to go back to after this war finishes. Now, mostly they need food, they need shelter. We're running short on shelters. Most of the public schools that are accessible have been full with people now. And those schools or shelters, they're not ready to receive those people, so we don't have any proper sanitation systems, no showers. Even those people, they don't have proper healthcare services within the areas that they have left to. So now, even with the social crisis, we're having a medical crisis as well, a health crisis.
Yeah, the situation with the hospitals. Lebanon's health ministry says some 13 hospitals in the south of the country are completely or partially out of service. What happens, Peter, perhaps you could explain what happens when communities cannot access health services at a time they need it the most?
Yeah, even before the war, there was a health crisis. So people couldn't afford to go to hospitals anywhere in Lebanon. And now with the war, and with the very, very limited resources of the government, people are finding it very, very hard to access health services, especially if they have different surgeries they can't afford, and even the hospitals can't cover those fees, and the government can't cover the fees as well. So I would say people are dying on hospital doors. People can't buy their medicines because either the medicine it's not even available in the market, or it's too expensive for those people to buy.
How do you handle this crisis when you're dealing with young children or mothers? What do you tell them? And besides, obviously, the basic needs, is there emotional counseling? Are there counselors and mental health experts who are helping these families cope with the trauma?
Yes, of course, within our teams and our health department, there's psychologists, psychiatrists, different social workers doing PSS, psychosocial services to those people. Of course, it's very hard, even for our volunteers in the field. Most of our volunteers are youth volunteers, so I'm talking about ages of 15 till 25, 2,000 volunteers in the field trying to support. It's hard for the people, and it's also hard for those volunteers delivering those services as well.
And Peter, finally, my last question to you is, what is your biggest concern the longer this crisis drags on?
The longer this crisis goes, the more the needs will be. Now we're facing huge challenges, and we're still at the beginning of this war. Schools are closed. People can't access medical services. their hygiene levels. It's a big discussion as well. The resources of the government and of the organizations are running low, and the needs are increasing day by day. So I'm pretty sure that we're going to face a huge problem months to come.
All right,
and
we'll leave it there.
People are not going to even find homes to go back to.
Yeah, it's just a really, really sad situation. Peter Mahfouz from Caritas Lebanon, thank you very much.